All right. It is another beautiful day in the Spice Island. Of course, we'd like to welcome everyone to another Mikey Live program. Again, the pleasure is mine to be back with you for another day. After a very long weekend, long in the context for some that they couldn't do anything, go nowhere, so it was just too long. It was long and drawn out. Lockdown, the first of two, you know. Well, I hope you made it because you're here, right? You might have grown a couple extra hairs and things like that, you know, just doing the penance, boy. No. Anyway, thank you for joining us. It's a pleasure. In tonight's news, multiple deaths at home for the elderly and concerns raised over carelessness. We'll talk about that. Cases of COVID-19 detected at Her Majesty's prisons. Over 160 police officers contract the COVID-19 as well. Don't be misguided by the weekend figures, says the Minister for Health. 4 men charged for trafficking cocaine. And of course, we have more. Do not travel. Warning issued for Grenada by the U.S. There are a lot more that we're going to tell you about during the course of the night. We are also waiting for our dashboard, usually getting it during the course of the program. So hopefully we'll get that pretty soon to share with you in terms of what the actual numbers are. And of course, we should be getting that any time from now. So let's say thank you to you for being here, the usual suspects and the first-time viewers, and to our sponsors. We got to let you know that the headlines was brought to you through the kind compliments of the Communal Cooperative Credit Union, Coach Grenada Limited, Digicel, Nawasa, the Housing Authority of Grenada, Real Value, IGA, Supermarket, and Superb Distributors. We would like to say thank you to all our sponsors of our headlines, and we're looking forward, after the break, to come back and tell you some news. All right, well, this is news discussed, not told. We ain't telling you nothing, we're discussing it. So let's take our break and come back. And someone sharing tonight's, someone sharing tonight's program will receive some free credit, compliments, Digicel, and that person could be you. And Ollie, when I text Ollie and tell Ollie win, don't take 3 and 4 days now, man. Ollie does get me mixed up and thing when Ollie do that. Sometimes I don't show if you get credit yet, and you know what I mean? So when I tell Ollie win, text me back one time Ollie number, all right? Good. We take a break and come right back.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
After being locked down during the pandemic, get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach chairs with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's summer in every drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc. and Peace and Georges.
How going on, boy?
Hey, good old things.
Hey, easy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016, or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches, and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays, 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 143114-232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
We are all essential in the fight against COVID-19.
At Courts, we're doing our part and we encourage you to stay at home, stay safe and shop online at www.shopcourts.com.
For added convenience, our Courts online customers will receive free delivery and get up to 20% off televisions, appliances and homewares. Plus, if you shop with Ready Finance, you will pay nothing down for 60 days. Now, you can stay home, shop online and save.
Remember, do the essential. Wear a mask, wash your hands, practice social distancing, stop the spread.
A message by the Grenada Distillers Limited.
You want a hand sanitizer to do 3 things: kill germs, be gentle, and to go where you go. You can get all of that in our hand sanitizer. Hard on germs, gentle on hands, affordable. Remember, hand sanitizers contain alcohol. Keep away from heat and flames and avoid contact with eyes. Available at retailers island-wide.
A message by the Grenada Distillers Limited.
Are you prepared for the hurricane season? Do you have a plan? Remember, water is essential in any emergency plan. Determine your family's water needs. Ensure your storage containers are food grade and store at minimum 35 gallons of water per person per day for at least 1 week. Understand that your planning may be different this year because of the need to protect yourself and others from COVID-19. Take the necessary actions to ensure that your household has an adequate stored water supply should there be an interruption. Be prepared. NAWASA, committed to meeting customers' needs.
All right, and welcome back. Now, there will be another post-cabinet briefing that will be tomorrow, God's willing. And of course, that will be with the media and there will be various persons on the panel. Honorable Nicholas Steele, Minister for Health, and Dr. Sean Charles, Chief Medical Officer, Acting, and the Director of Medical Services, Acting, Dr. Taisha Donald, and Medical Officer in the Ministry of Health, Dr. Mayana Charles. All right, so that should be a very interesting press conference by the Ministry for Health. Again, that will be happening tomorrow, God's willing, so please look forward to that. All right, good. I see we have some people here for the first time on the program. What take all this so long? All right, anyway, welcome you here, Papa, and don't forget to share the business. All right, so the next thing that we have to tell all you about, boy, according to police, it was a relatively quiet weekend. All right, no major accidents and stuff like that in terms of infractions. They were saying that there are some minor infractions, like they were able to charge some persons for not wearing masks or for opening up businesses without having the authorization to do so, because you're not supposed to do that. I've been in lockdown. So there are some shops and stuff that were opened. Still, all the people had a hell hard, So there were a bit of that happening on the weekend, and so the police said they had to deal with some of that. But that was it. Yeah, nothing too major happened on the weekend. Although they are a bit understaffed, they are still coping. Now, according to the Prime Minister in our latest interview, the Prime Minister said over 160 persons, just about, in the Royal Grenada Police Force tested positive for COVID-19, and there were some other people in isolation. So that proved to be a challenge for the police, but the Prime Minister says despite all of that, the police, they are still getting the work done.
Well, I think don't forget the policemen come from our own society. They have their own challenges. Remember, they have their families and they have their own issues. So I think they're trying their best. The leadership has been trying well. As you have heard, there are a number of policemen, I think over 160 odd policemen now who are infected, which means that many of them have to self-quarantine, and it's affecting themselves and their family, and of course affecting the productive level of the force. They are trying their best. They are giving government the support they can. The leadership is trying, but at the same time, there are serious limitations. So it's a tough act for everybody. With a lockdown this weekend, for example, policemen have to literally, almost every policeman have to be almost working 15, 16 hours. Otherwise, we won't be able to achieve a significant impact.
You hear that? Close to 16 hours some of these policemen have to work for. You understand? Our police officers. Now, I'm concerned with the strain on the force, with the strain on the health system, and if we are to get a tropical depression, or tropical storm, or tropical whatever, whether or not we are going to be able to manage that. I don't know if we are already starting the conversation of regional assistance from the RSS, for example, you know, in managing in the event of some sort of major hazard, you understand, affecting us and causing there to be a disaster. You know, Olio, we have received word that there are persons among the prison community who have tested positive with COVID-19. We have also heard that not only are officers infected, but also prisoners are infected with the COVID-19. And of course, we are awaiting, we're not going to jump the gun yet, to get the actual figures from the Ministry for Health. The last time we asked the question, they said that there were people in isolation, but they couldn't give the definitive answer as to whether or not there were persons who who contracted the virus. They said they were awaiting the results. And of course, well, I've been reliably informed that there are some tests, at least 4 tests, came back positive according to one source, and from prisoners, and a set of more prison officers who were infected with the COVID-19 as well. How the prison plans to manage that? Maybe they need to start coming out too and having their own press conference. I think information is very critical during this period. Otherwise, if you make somebody else control that narrative, partners, all cocoa ripe. Don't let nobody else control the narrative. You need to come out and speak. You know what I mean? All right. Because other people will be talking. Now, it's been more than a week. We've been getting calls with persons expressing concerns with a particular, well, first of all, with elderly homes and the way some of these homes are being managed, right? There was one home in particular that was under the microscope. That was the Hilarion home for the elderly out there in St. Patrick. We have received multiple reports of persons who are infected with COVID-19, residents there who are infected with COVID-19, and as well even staff members who were infected. Well, of course, the people, some of these, the residents of the home, they're not going away. So of course, somebody came from outside and bring it into there, right? And they were concerned that there were even staff members that were allowed. We're not able to independently verify that part of it, where there were staff members who were aware of their positive COVID-19 status and were still working at the facility. All right. So we've been told that at least 6 persons from one elderly home has died. Let's say within a 2-week period. At least 6 persons. And we take that lightly because maybe it's not our grandmother. Because I don't understand this. You understand? So we have loved ones of residents there expressing disgust that this situation was allowed to go on while people die. Well, even the Minister for Health, Nicholas Steele, expresses some frustration as it relates to this situation in the homes.
Chris, that is one of the most frustrating areas of this and disappointing areas. I personally met with managers and members of these convalescent homes and begged and pleaded with them to get vaccinated and have their staff vaccinated and their residents in their care vaccinated. I personally went to some of these homes to assist in the vaccination, to make sure that it was done, was given priority. Any home that requested the vaccinations, that they got it immediately. We begged and we pleaded. And over the last months, not only has there been an outright resistance, but there's been a level of arrogance. I'm the one being called arrogant, but look on social media, some of these individuals have proudly touted the fact that they're not vaccinated and looking after our elderly. They proudly stated this. And this truly, truly is regrettable and is and could have been avoidable. We have our most vulnerable who definitely have not left. They're shut in and have had this disease brought to them by individuals who, frankly, I have to say it, have been irresponsible, have not heeded the warnings. They cannot say they haven't seen what has happened in Canada, in England, in the US, many other places around the world to homes for the aged. They cannot plead that ignorance. And they really do need to step up now and try as best as possible to mitigate this.
Yeah, but these are real situations. Yeah. So, have we done enough? Who's responsible for the home? Is it the church? Who is it responsible? Wasn't there a strategy that should have been implemented? Because I remember I did a story here a couple months ago when a lady was denied access to a home. You guys remember that, right? She was denied access to a home because I think it was for Christmas that she wanted to bring something for her mom, and not the same home though, another home, and she was denied access, right? And so sometimes I just wonder, what is that all about? Is that to just show that we have a little power? Because if we're going to let this kind of nonsense happen, how are you going to tell somebody now? The mother, they put you in charge, they pay you, you have a duty of care to that individual, and you kill them? You're mad? To come and call people and tell them, I'm sorry, Mrs. Cynthia, you had somebody who died there too, right? I see somebody in the chat, somebody speaking about it. I'm sure there's somebody who here on the program who was had, so they call you and tell you what? What do you really tell you? I'm sorry, but your Mrs. whoever and Mr. whoever died from the COVID, that somebody bring for them, the same people who's getting paid to keep them alive. Hey! You will call me and tell me that joke you making, you mad or what? I make it watch like a pension, or they pay me for the rest of my life. For the grief all they put me through. And that if that person have children, all have to support all of the children, whether they are children or adults, until they're dead. I saw it down to the earth in the basement. You understand? All the two out of boy. We're not talking about one death in a dog. 2, 3, 4, 5. What? Under whose watch? Are you mad? Under whose watch? You crazy, boy? Anyway, let leader talk, because you see, I go get kind of ghetto. So let leader peace. Forgive me. We're moving on. All right. Oh yeah. 41 new cases of COVID-19 was identified on the weekend. All right? Again, there were deaths that were recorded on the weekend, and some people that were very popular, people, you know, there are people who people know. You understand? Despite those numbers, the Minister for Health, and I saw it too, is saying, hey, don't get it twisted. This is no indication that things are getting better. It only means that we did not do much testing on the Sunday, which was yesterday. And that is why the numbers look like that. But hey, the numbers are in reality not pretty.
That although you would see positive cases for the 24 hours into Sunday as 41, please do not assume that that means that that's all that is there. It was a Sunday. We did have volunteer teams as well as our teams out there, and we wanted to make sure that the dashboard went out as best as possible at 8 p.m. or immediately afterwards. So there were some reports still that were not in. So those are going to be incorporated into today's figures as well. Based on our analysis and observations in the field, we are not over the hump as yet.
All right. Okay. Yes. Thank you very much. All right. So we are really and truly not out of the woods as yet. Speaking of not out of the woods, let me push up. Let me show you something on the screen. All you seen on the screen, all you still seeing me? Look at that. Look at what happened to us. I don't even have to read. That's not even our story. The U.S. Department of State issues a do not travel advisory against Grenada, you know that. Put us on level 4, you know that. You understand? In other words, they're advising persons to not to travel to Grenada, you know that. Okay. All right, partners. We are not the only Caribbean island there. We have St. Kitts and Nevis there too. You understand? I see they put Belize there. I mean, yeah, some name I can't pronounce, but they there too. You understand? No, that. But anyway, if all you have to come, all you have to come. We don't miss all. You understand? So they have a do not travel, you know, thing on us. What they were saying is that these countries have been raised, the alert level has been raised or reinstated for these countries, all right? That'll put us out one bit. Just that you know. You know what I mean? Just that you know. So we're moving on. So here it is. The next thing that we have to tell you about, boy, according to the police, boy, that's officers attached to the drug squad, they say arrested and charged 4 men, inclusive of a Trinidadian, after 9 kilograms of cocaine was seized during an operation on Monday, 6th September 2021 at Marquee in St. Andrew. Charged are Lyndon Francis, Raheem Francis, and Rondell Rogers, all fishermen of Sobeys, St. Andrew, and Cordell Douglas, a national of Trinidad and Tobago. Douglas also received an additional charge of entering the state without the consent of an immigration officer. Now, he appeared during a special sitting of the Grenville Magistrates Court on Friday, 10th September 2021, and was remanded to custody at Her Majesty's Prison. Douglas will reappear in court on September 20th. The other accused men are scheduled to reappear in court on Monday 13th. That was supposed to be today. I have not received an update as to whether or not they did, in fact. All right, so probably tomorrow, God's willing, we can try and see what we pick up on that for you. You know what I mean? People, we doesn't jump into conclusion and think too quick. So we've been getting reports of that, of the home and how they're managing the home. We've been getting reports since before the first death. We've been getting reports on that. And you know, sometimes we're slow to come out to say things, but people don't understand that. Because we have to you know, go deeper to see, you know, how credible the information is. You understand? And it's just heartbreaking to know that that all of the suspicions, all of the concerns that were expressed even before one person died came to realization. So if one common man could see it, if one family member could see it, or two, you're telling me we had to wait to reach till somebody dead? And we say 6, but it's not 6. We could tell you 6 safely. But there are other deaths. But we know we don't have the records to say for sure how they died, so we can't say that. They may as well. You understand? No. Anyway, Olia, how are we looking for time? Well, I'm planning to go wrestle. Well, locks and shake up the locks and thing and yeah, I mean, yeah. Because we don't know how long that lockdown will be for, you know what I mean? Olia, we're going over in Trinidad, boy. In in Jamaica first. Let's go Jamaica quickly. 9 murders occurred on Sunday, the first lockdown day of the weekend. You understand? 9 murders, you know. When people supposed to be inside, like lockdown, people dead in. They're killing people in Trinidad, in Jamaica. I don't know how. You understand? And there was something else I wanted to tell you, boy. You know, from time to time we hear about children and how they meet their demise. And there was a story in circulation yesterday with a youngster, a little boy, only 4 years old, Trinidad, mauled to death by a dog while visiting his family. You understand? It was a grim scene, boy. You understand? They say what was supposed to be a quality time spent with his grandmother, it ended in a violent and bloody death of the 4-year-old. Messiah Lewis of San Juan on Saturday. You understand? They say that he was mauled by a Rottweiler, you know. Now, according to eyewitnesses and relatives, Lewis came with his 3 siblings to the Savannah Drive, right, where his 67-year-old grandmother was the caretaker of a home in the absence of the owners of the home. When the Rottweiler dog broke out of its kennel, the dog immediately took aim at the little child. They say the child was at the yard, you know, he come, granny, you understand? They say the construction workers, they had a bird's eye view, you know, they were on top of a building or something, and they saw what was happening and gave an account. You understand? They say the incident happened around 11 a.m. You say you just see the dog come out, and they see the child, and they run towards the child. So the child started to run. So the child running, and the dog running behind the child. And then the dog grabbed for the child's neck and pulling. They say grandmother fall, trying to rescue the child, but then grandmother holding to the child's foot. You understand? And the dog holding on to the child's neck and he pulling. And the dog grabbing, and you see by the time ting. You know, child passed away. I just get sick when I hear them kind of story. Police came to the scene and they shot the dog. They killed the dog, you know. They killed the dog for doing that to the child. So the dog dead, child dead. Mother grieving. Owners at the home, mother, I don't know how that one go work out. You understand? But anyway, that is what it is. Folks, it's against my conscience. You see, I don't try to behave, I don't try to behave, but, you know. So I see, we're promoting volunteers for doing COVID-19 tests and helping out the Ministry of Health because, you know, they are short staff and they're understaffed. So So they came out in a number, some of the volunteers, on the weekend. And they, they were in various areas doing the testing and administering the vaccine and things. Okay, that's cool. I wait for the whole day to pass. I didn't see them promote in no way, in a significant way, the local team who's been working like donkey day and night all over the place. But you know how we is already? We like things with color. You know what I mean? And I do not understand how it is that we miss the mark so often. So all of a sudden, we are featuring the good work of the helpers, of the volunteers, while the local team still in dragging through bushes. You understand? But I tell everybody, I don't understand what's going on. You understand? That affects the morale. It will. Because there they are. You know what I mean? It's like, you're in a relationship whole time, you're in a relationship and you're jamming, you're taking what you get and think, okay, I'm taking the good, the bad, and the ugly. You understand? You're jamming. Your boyfriend or whoever, they don't want to do certain things, you respect that. They want to do certain things, you're there with them, jamming. And all of a sudden, they pick up somebody new, things they never do in their life. Things they never want to do. You see, they jump up and they're still taking video and think when they're doing new things. You understand? And you wonder, hey, that's the same man I was with? That's the same woman I was with? Well, what? Someone, you see, we don't think. We don't think. So you feature in the foreigners, and you feature in the colors, and you feature in the people who come and help for 2 days. And you forget the people who's been doing the thing. Doing the work of 3 and 4 people. It may seem simple. It may seem simple. It is not. It is not. You understand? And that's the kind of mentality we have. Let's compare that to the outbreak that we had when it was December last or something. It was an outbreak at a hotel in the south of the island. I'm coming to Holland. It's a point I want to make. A hotel in the south of the island. But when they hit the shoe on the other foot now, it's jab. You get me? We have to stop that. We have to stop that. We have to stop doing that with people. You understand? We have strength when it comes to one class of people. And when it comes to the next class of people, it's another story. You understand what I'm saying? We can't continue to do that. We cannot continue to do that. And probably that's where we are where we are. Unemployment skyrocketing. But guess what? People not going into the nursing industry. Why? You go fight, go figure. You understand? They would prefer do something else. So the whole nursing thing dry up. Listen, just now people, it's self-care. The way the thing going, just now you're going to be self-care. Because all the nurses are going. Why? They're just going, they're disappearing. But you see, if it is me, who's a nurse, that working on the ground like these nurses are working right now, and I see something like that, of course I would have a problem. I'll have a big problem. No, I wouldn't have a problem. All you're going to have a problem. You understand? Because the sacrifices I want to make, I wouldn't make it. If that's how you treat me, if that's how you handle me. Yeah, it might be an oversight, but we can't make that mistake on them, dad. You understand? It might be an oversight, you know. Yeah? But we can't make them kind of mistake, dog. Because the reaction that you get from that is like reflex. I telling you, dog. It's like reflex, the reaction that you get from that. And you can't reverse it. A mind, once exposed to an idea, cannot and will not go back to its original state. So if for all this time, the people just working because it's about the work and it's about serving, the moment you give them the opportunity to think otherwise, that's it, it's a wrap. It's a wrap, dog, I'm telling you, it's a wrap. So let me don't make them kind of mistake, no, man. Let me don't make them kind of mistake, dog. You know, let me don't make them kind of mistake. Anyway, you understand? Oh, God. Anyway, let me let that talk, eh? Let me do that talk. Action speaks louder than words. Okay? So I think we're running out of time. I want to take a little break and thing and come back. And when I come back, it will be a real thing. Because we're still waiting for the thing. We're still waiting for the thing, eh? And then we're still waiting for the dashboard. But we have the national report for you. We also have the weather for you, so maybe between that time, we might get a little thing for you. If you don't get it, that's a small thing, because we'll still be able to post it for you. That's why you should follow us. We have a WhatsApp group, all right, people? We have a WhatsApp group. Well, we have several WhatsApp groups. We have sent out invitations. If you want one, you could just send us a message and we'll be able to send you an invitation. There's no chatting in those groups, all right? It's only a one-way communication, so we send you things. So even if you're not on the program, we'll send you things, yeah? So that you're able to know what's going on. I'll share the program too. Share the program. Share the thing. So all the way coming back now. And when we come back, well, yeah, we go see on the other side. Hold on. We're coming.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
After being locked down during the pandemic, get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach chairs with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's summer in every drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc., Tempe, St. George's.
How going on, boy?
Hey, good old things.
Hey, easy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016, or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 14-3114-232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Customer services, bill payment, revenue collections. It's the official opening, NOASA's Lucas Street headquarters, Tuesday, June 22nd, 2021 at 8 a.m.
Come, we are excited to serve you.
NOASA, committed to meeting customers' needs.
Are you prepared for the hurricane season? Do you have a plan? Remember, water is essential in any emergency plan. Determine your family's water needs. Ensure your storage containers are food grade and store at minimum 35 gallons of water per person per day for at least 1 week. Understand that your planning may be different this year because of the need to protect yourself and others from COVID-19. Take the necessary actions to ensure that your household has an adequate stored water supply should there be an interruption. Be prepared. NOASA, committed to meeting customers' needs.
Welcome to Yogo. Most of you know us for our food delivery service and our food pass for free delivery from restaurants. But did you know you can also use us for grocery deliveries too? We've just added another 5,000 plus new items to Yogo Supermarket. And stay updated as we add more products and vendors. Yogo Services is our convenient skip the line offering. Let us pay your electric, water, and other utility bills for you. With us, you will be able to buy tickets, pay your rent, schedule bookings, and other services. Need a ride to get somewhere? Give Yogo Lyft a try. Select your pickup location and destination location and wait for our driver to collect you. Never have to worry about how you're gonna get to a place again. Please see website or app for our service locations. And sign up now.
Summer is ending, but the deals are just beginning with the Court's end of summer sale. Get up to 50% off your favorite items, to include patio furnishings, pools, coolers, TVs, mattresses, and more. Plus, shop today with a ready finance and pay nothing for 60 days. Take advantage of these sizzling summer deals for a limited time only. Shop in store and online at shopcourts.com. Conditions apply. Courts, bringing value home.
It's your summer everything loan from the Communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a summer everything loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your summer everything loan from the Communal. Apply today and take advantage of this exciting offer. Visit the nearest Communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
This is the National Report for Monday, September 13th, 2021. In the headlines, close to 1,000 people were either vaccinated or tested in clinics held over the weekend. Details to this story and others after the break. With the news in detail, I am Leslie Ann Johnson. Close to 1,000 Grenadians were either vaccinated or tested as teams of volunteers working in partnership with the Ministry of Health staged clinics throughout the island over the weekend. Statistics show that 405 people were vaccinated and 410 were tested as part of a vaccination drive. Of that number, 142 were vaccinated on Saturday and 263 on Sunday, while 70 people were tested on Saturday and 340 on Sunday. The drive, which involved doctors and nurses from the General Hospital, doctors from the St. George's University, members of the Cuban Brigade, and Grenadian volunteers, was the brainchild of Dr. Nilo Alvarez Toledo. Being the first of two no-movement weekends, the teams of medical professionals and other volunteers decided to take their services to the various communities to make testing and vaccination more accessible to the population. Director of Hospital Services, Dr. Carol McIntosh, who spearheaded the mobile team in St. David on Saturday, told the Government Information Service that education is essential to people making the best decision to protect themselves and their family. She says while they will visit new areas next weekend, the plan is to go back to the areas already visited to test and vaccinate those who are now ready.
Those who came and had the test done, or had the vaccination done, and went back home and told them, yes, I had the vaccination, this is what happened, and these are the people that did it. That reinforced the trust, and reinforced the lesson there. So they believe going back into that community where they may not have come out as, they may have been reluctant in coming out, that they will be ready to come out again because they know that this is a group that's come back again. And talking with people in the community, it's like, yes, you have to keep up with it. You have to keep up the constant so people understand this thing. Well, they're coming back. There were times with the same team, not only while they were sitting there, they heard that in another area there was a group that was waiting for the team to come, but the team may have had a lot of people and couldn't move. They went, took their car, drove to the people, picked them up, and brought them to the area, and then drove them back. So they saw that people are making the effort. We had Nurse Lyons, I have to mention her specifically, and we had Arlene Hardy. I have to mention her specifically, our team leaders that were working. And the ministers, Minister Steele, Minister Thomas, and Minister Modest, they had community leaders that they brought out to assist us who were very open, who were saying, okay, we said, look, we need to do vaccinations. And they went and said, we're going to bring you here.
In St. David, teams were in Latante, Pedmota, La Sagesse, and the respective health centers. Services were also provided at the Rose Hill Community Center and at the St. John's Anglican School in Guave, as well as the Woburn Health Center and on the Calivini Main Road, and Victoria and Union in St. Mark. Dr. McIntosh applauded the work of nurses who have to go into remote communities to provide testing services to people, some of whom do not have the means to isolate if they begin exhibiting symptoms.
These doctors, nurses, staff, everyday person, your everyday Grenadian came out to help his or her fellow Grenadian work over 12 hours. And that doesn't negate. It actually made us understand people in the community, the nurses that go out every day to do this, how much work it is, and really understand that we need to pull more and more people. Everyone. And people seeing that appreciate the fact that we went out. I have to tell you, I went into places I didn't even know existed in Grenada. And you walk up and up and up, and then you came to the house, and you're sitting there, and you start to understand the difficulty. When you go into a house that is only 2 rooms, and you have 5 people that are in that house, and 3 are positive, and we're telling them to isolate. It's like, what am I saying to you? I have to sit down now and explain to you how you can isolate in this type of situation. So, and then when we do that, it was helpful because then people understand, well, you can't isolate per se, but you can also vaccinate. That will help to protect. We had one woman that came, and this was cut this late on Sunday evening. She went to 4 houses, and we had 8 people that came out on the side of the street to get vaccinated. We opened our car door, had the roof up, used our cell phone lights, ended the vaccination.
She says they have the support of more than 50 volunteers so far, with a list of others waiting to give of their service. Health teams will provide services in St. Andrew and other areas in the coming week. Grenadians in the diaspora will meet in a virtual information session on Tuesday to discuss how they can lend their support as the country continues to deal with the rising cases of COVID-19. Head of the local Office of Diaspora Affairs, Derek James, says pledges have already been made by individuals and organizations in the diaspora, and some of the donations are already on their way. Tuesday's meeting will discuss how further assistance can be provided, but in a structured manner.
Tomorrow's meeting is to make an effort to let people know that the Office of Diaspora Affairs here in Grenada is here to support them and to coordinate all the donations that will be sent to Grenada. Because we just don't want everybody just buying anything that's not needed and shipping things that we don't know when it reaches, we don't know who it's going to, and so on. So we want to make sure that we coordinate all the donations, and also to tell the diaspora that there are point persons in the different regions, point organizations in the regions that the donation should go through. So we have a better coordination of it, and we'll be able to monitor what's coming, where it's coming from, the value of it, so we could go back and say this is what came from the different regions and so on.
When he had reached out to members of the diaspora in Canada, especially those in the Grenada Disaster Preparedness Committee in Toronto, hand sanitizers were purchased and shipped for busmen in Grenada. Subsequent requests were made to members of the diaspora in New York, Queens, and elsewhere.
I want to use the opportunity to say thanks to the members of the diaspora who came forward and requested that they get an opportunity to support. And I want to say the individuals and organizations who did that. And so tomorrow's meeting is a cry to our nationals out there to help in this difficult time, because as you know, this thing is for all of us. And also not just in terms of support in material, but also in the area of calling family members here in Grenada and encourage them to take the vaccine and encourage them to follow the protocol that is given by the government.
Tuesday's information session begins at 7 p.m. and will be on the Facebook page Grenadian Diaspora. This is the National Report. More news after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Continuing the news, vaccination and testing continues in Carriacou this week. The COVID-19 response team for Carriacou and Petite Martinique and the Ministry of Health say there will be a COVID-19 vaccination pop-up clinic for adults and children 12 years and over at the Hillsborough Tennis Court on Tuesday from 9 a.m. to 2 p.m. People have a choice of either the Pfizer or AstraZeneca vaccine. Parents are advised to accompany their children at the vaccination pop-up clinic and have a valid ID in their possession. Another vaccination pop-up clinic will be held at the Hillsborough Tennis Court on Thursday and in Petite Martinique on Friday. The impact of COVID-19 on the farming and fishing sectors were examined recently in a forum which discussed how the sectors can operate in the current environment. It was organized by the Ministry of Agriculture, Forestry and Lands and looked at, among others, how farmers can organize themselves into groups, associations and cooperatives to allow for more effective communication with the ministry. Prime Minister Dr. The Right Honourable Keith Mitchell said the meeting is a good way to support the government in coming up with measures to help develop the sectors.
I welcome this opportunity to get the response and, of course, the recommendation coming from this what I call extremely important session here today. And I want you to rest assured, my colleague, brothers and sisters in the farming and fishing community, you can take it from me, and I'm sure the minister would reinforce that. Your recommendation, given what you are trying to do and we are trying to do together, will not be taken lightly. I do know that everyone knows that government is affected like anybody else, because there's some of us who believe that the government has the resources to do everything. And I know the farmers understand differently. And but we will do what we have to do within the limited resources of government, because a successful farming activity, particularly in this time, and fishing activity, is a success also for the country as a whole.
An appeal was made for farmers and fishers to operate on a united front by way of farmers' organizations.
We need to make sure that the farmers involved in chicken, poultry, the farmers involved in pigs, in goats, in small ruminants, farmers involved in vegetables, the soursop, all of them better organized and strengthened. And certainly we at the ministry would like to find ways. I know this is something that the Senator Sinclair has been echoing and speaking to for quite some time. It's a challenge we have, but I think if we do that, you see, it is much better to get what you've done through strength, and strength comes through being together. And that, I think, coming out of this meeting, I think if we can have the farmers' organization strengthened, and ultimately having a national farmers' organization is something that would certainly give more voice to farmers and give more strength to farmers. And I've said that time and time again. But I think we had a great day. I think we've achieved a lot. I think there's a much more to happen, and I'm sure we'll be sitting together, the Chief Agricultural Officer, Senator Sinclair, our agriculturists, the permanent secretaries, all of us will sit to find ways to really build the capacity within the industry.
The information from the virtual meeting will be used by the ministries to draft a policy that can guide the way forward for both the farming and fishing sectors.
I'm trusting that out of this dialogue here, we could then start framing the agenda moving forward.
It was a very good meeting. I was very impressed with the level of the meeting and the kind of contributions that were made. And it's all noted. We are going to continue the conversation, both ourselves and including Senator. And all of you, we now have your email addresses, etc., and better connections. And I enjoyed the meeting and the tone that is taken. And the people are in a mood to work together, and that is so very important.
Presentations were made by Dr. Sean Charles, Chief Medical Officer, on vaccination coverage and the need to focus on combative measures to deal with COVID-19. Permanent Secretary Mike Sylvester from the Ministry of Finance presented on the current stimulus package available for farmers and fishermen and the impact of COVID-19 on the economy, while Commissioner of Police Edwin Martin presented on plans by the Royal Grenada Police Force to support members of the two sectors. And that's the National Report. I'm Leslie Ann Johnson.
Well, thank you very much, Leslie Ann. And of course, we will have another program for you that will be on Tuesday. Okay, so we have not yet received the new COVID-19 numbers. However, we received an update relating to a death at the St. George's University. It says, "It is with deep sadness and regret that I inform you of the loss of one of our Charter Foundation students this morning. Nashida Sapp, a student from the United States, died tragically from an unexpected medical emergency. Emergency service care was provided at our campus and Grenada's General Hospital. We are not aware of any connection between this student's medical condition and the COVID-19 pandemic. We convey our heartfelt condolences to Nashida's family, friends, and classmates during this difficult time." All right. It seemed to be an internal circular that went out regarding this particular incident. I'll try to see if I can find out more about this this death that occurred there. I take note of the wording, you know. All right. What else do we have to tell you? Okay, we have for you the weather. Let's do that. I'm still hoping that we will get that thing before we leave. All right, so let's just take a look at the weather. And of course, this is presented to you from our good friends that we friends, because they're very consistent in sending us the weather at the Met Office. The weather is expected to be partly cloudy with a medium chance of a few light isolated showers by early morning. Now the minimum temperature for tonight, 25.5 degrees Celsius. That's a bit warm. Winds easterly to east southeast. Well, warm for me. Easterly to east southeasterly at 5 to 15 miles per hour, becoming variable to calm at times. Now seas slight with waves up to 4 feet in open waters. And that is weather report. I also heard that possibly one of the oldest person in Carriacou was tested positive for COVID-19. One of my sources there shared that with me today, that Mikey, the oldest person in Carriacou, tested positive for COVID-19. I know there were also mountain cases in Carriacou and Petit Martinique, and I know that there is a home for the elderly there as well that were hit by COVID-19 too. You know, so I just hope, you know, people, you know what I hope? I hope that we can get this thing under control, you know. And earlier tonight, I spoke of the way I felt, how I felt that we erred in how we treat some of the local nurses, you know. And I think I would have erred a bit. Maybe some may interpret it that, you know, I fail to acknowledge the contribution of the volunteers. And, you know, I would accept that. Yes, we have to acknowledge that the volunteers, it's not their fault, that they are doing what they have to. They are doing what they don't need to, but still what they have to in order to help us to get out of this situation. So we have to, and we cannot, in our quest to make sure that we get it right on our end, we cannot underestimate or undervalue their contribution towards the entire thing, you know. And so, in my commentary, I think I could have done more in highlighting that. And so I wouldn't be fair to them if I go off before at least making that right, you know. So we want to let you know that we really appreciate your contribution. You didn't have to do it, but you are doing it anyway, and that's good. You understand? We really appreciate that. And if we could get some more friends, let it come, man, because we really need the help. You understand? So that has nothing to do with you. Yeah, you just collateral damage in the whole thing. You know, it's more, you know, you have a responsibility to meet certain expectations just the same, and to make sure that in whatever we do, we do not go further away from our goals. You understand? That we are deliberate in our actions, and you know, when we act, we are confident that we are doing the right thing. We might make mistakes along the way, but let's not make foolish mistakes. Yeah. All right, so folks, I think we have taken up enough of your time for now. What I'll do is, like I've said, and I see some people have texted me already. What you'll need to do is to send us a message on the page or something, so that we can add it to our WhatsApp chat, or to our WhatsApp group. It's not really a chat. We don't chat on there, right? So that as soon as we get the updates, we can send it directly to you, so you don't have to like be on the program to get those updates. Because for people who are members of those groups, they will tell you, they get to know things first, really, because as soon as we get those information, we send them out immediately in those groups. All right, so you get it first. All right, before we go, let's say hello to the people on YouTube. We know that you're there. Thank you very much for being with us. And also, we'd like to say hello to all the people on Facebook. Really, we see the people making noise on Facebook. Donna, Deslin, Deborah, who else? Deslin, Shireen, Rayburn, Naughty, Sharon, Audrey, Joseph, Paul, Lauren, Kieran, Anne, Rachel, Jason, Brenda, and Chemo, Spicy, Ansha, and everybody else. Okay, I think that dashboard is coming out now. Just 1 second. I think, let me just check. Anne-Marie, I think it's coming out. Just give me a minute. In the meantime, Joel, Susan, and I'm thinking, just give me a day or so. I'm thinking that we should try to see if we can assist the on-the-ground workers. So this is one of the things that I'll try to do. I'm thinking about maybe we can get some cases of water or Gatorade and PPEs and stuff like that. I'll try. But I'll first consult with the Ministry of Health to find out what their needs are, and if we take it upon ourselves to go there and find the teams where they are, and help them out. If there is need for that help, okay? If there is need for that help. Yeah, because I'm thinking, as citizens, we can do our part too. All right, as citizens, we can see if there are ways that we can help and go ahead and do that. We don't have to always wait, and sometimes complain about things and not do anything about it. That's one of the things I don't do. When I complain, it's because I'm doing something. Yeah, Azan? Because if you ain't doing nothing, you don't have the authority to complain. Plain talk, bad manners. I was trying to see if I can actually get that that dashboard for you, because okay, let me see what it says here. Okay, yes. All right. Whoa. Okay, so as it relates to the COVID-19 dashboard, we see here that there are a total of 260 new COVID-19 cases. Again, 260 new COVID-19 cases. Number of cases currently in hospital, check this out, 68. That far exceeds what we were told in terms of the numbers that they can accommodate. So they are making room somewhere, somehow. Total persons in isolation, 2,063. Total persons in quarantine facilities, 356. All right. Check this out. Total active cases in Grenada now stands at 2,063. Again, the total active cases of COVID-19 in Grenada stands at 2,063. 8 of these cases are imported, so that leaves us with 2,055 local cases of COVID-19. And check it out. Deaths, the last time I told you was 27. So it moved from, was 19, 24, 27. Now stands at 35. 27, 28, 29, 30, 31, 32, 33, 34, 35. Okay? You remember when the last dashboard was? You remember when the last dashboard was? Hold on. Hold on. Just give me a minute. I don't talking out of my head here. The last dashboard we told you was on the 12th. Yesterday was the 12th. There were 27 positive cases. Prior to that, there were 24, which was the day before. All right? Prior to that, the day before that was 19. Okay, so let's just talk from last night to now. So from yesterday to now, 27, 28, 29, 30, 31, 32, 33, 34, 35. Good night, people. Have a good night, and we'll see you tomorrow. God's willing. Be on the right side of history. May God bless you and your family. This is a serious situation that we are dealing with, and I hope that this situation is going to end sooner rather than later. Because I don't sleep well at nights thinking about those things, and I'm not the only one. Yeah, my belly boil, you know. These are these are people that we know, you and I know. You know, these are people that you and I know. Have a good night. And may God bless you again. And I want to see you tomorrow. I want to see every one of you tomorrow. Good night.